What if I told you that inside your medicine cabinet right now, there's a substance so powerful that doctors around the world are calling it nature's forgotten miracle worker, a simple white powder that costs less than $1 but can address 15 serious health problems that pharmaceutical companies charge hundreds for. You probably walked past it this morning without giving it a second thought. Yet this humble household staple has been quietly revolutionizing health outcomes. For those who know its secrets, I'm talking about baking soda, and what you're about to discover will completely change how you view this ordinary kitchen ingredient. Dr. Ricardo Terra, a leading specialist in integrative medicine and author of over 50 peer-reviewed studies on natural remedies, has spent the last decade researching what he calls the most underestimated therapeutic compound in modern households. His findings are nothing short of extraordinary. Picture this scenario. You wake up with that familiar burning sensation in your chest after last night's dinner. Your first instinct is to reach for an expensive antacid that costs $3 per tablet. But what if I told you that a teaspoon of baking soda mixed with water could provide the same relief in under 2 minutes, and it would cost you less than 5 cents? This is just the beginning of what we're going to uncover today. We're about to explore 15 scientifically backed ways that baking soda can transform your health, save you money, and provide solutions that Big Pharma doesn't want you to know about. But here's what makes this different from everything else you've heard. Each of these applications is backed by rigorous scientific research, and I'm going to show you exactly how to use them safely and effectively. Before we dive deep into these life-changing revelations, I need you to do something for me. Drop a comment below and tell me which health issue you're most eager to solve naturally. Are you dealing with digestive problems, skin conditions, or maybe joint pain that just won't go away? Your engagement helps me understand what matters most to you, and it helps this crucial information reach more people who desperately need it now. Let me be crystal clear about something important. While baking soda is completely natural and available without prescription, it's not without its considerations. Throughout this presentation, I'll be sharing specific warnings and guidelines that Dr. Terra emphasizes in his clinical practice. This isn't about replacing professional medical care, it's about empowering you with knowledge that can complement your health journey. The first revelation that will shock you involves your digestive system. If you've ever experienced that awful burning sensation of heartburn or acid reflux, you know how it can completely ruin your day. The multi-billion-dollar antacid industry wants you to believe that you need their expensive formulations. But Dr. Terra's research reveals something fascinating about the alkaline properties of sodium bicarbonate. When acid builds up in your stomach and begins to creep into your esophagus, your body's pH balance becomes disrupted. Baking soda works by neutralizing excess stomach acid through a simple chemical reaction. 1 teaspoon dissolved in 8 ounces of room temperature water creates an alkaline solution that can provide relief within minutes. A study published in the Journal of Clinical Gastroenterology found that sodium bicarbonate was as effective as prescription medications for immediate heartburn relief, without the side effects or cost. However, Dr. Terra warns that this should only be used occasionally, not as a daily treatment. People with high blood pressure or those on sodium-restricted diets should avoid this method entirely. As baking soda contains significant amounts of sodium, the second discovery involves something that affects millions of people worldwide, yet most suffer in silence. Urinary tract infections cause excruciating pain and frequent, expensive doctor visits. Research from the University of Bristol demonstrates that baking soda can create an alkaline environment in your urinary tract that makes it difficult for harmful bacteria to thrive. Dr. Terra explains that by drinking 1/2 teaspoon of baking soda in a large glass of water twice daily at the first sign of UTI symptoms, you can help your body fight off the infection naturally. The alkaline environment disrupts the bacteria's ability to multiply and adhere to the urinary tract walls. Clinical trials showed that this method reduced UTI duration by an average of 2 days compared to waiting for antibiotic treatment. The warning here is crucial. This method should never replace antibiotic treatment for severe infections, and anyone with kidney problems should avoid this approach completely. But here's where things get really interesting, and what I'm about to reveal next will make you question everything you thought you knew about expensive sports recovery products. Athletic performance and muscle recovery represent a massive industry, built on expensive supplements and recovery drinks. Yet Dr. Terra's research uncovered something remarkable about baking soda's effect on exercise performance and post-workout recovery that the sports nutrition industry doesn't advertise. During intense exercise, your muscles produce lactic acid, which causes that burning sensation and fatigue. This buildup of acid in your muscles is what limits your performance and extends your recovery time. Baking soda acts as a buffer against this acid accumulation, allowing you to push harder and recover faster. A groundbreaking study in the International Journal of Sports Medicine tested athletes who consumed 3 grams of baking soda dissolved in water 30 minutes before high-intensity exercise. The results were staggering. These athletes showed a 12% improvement in performance duration and reported significantly less muscle soreness 24 hours post-exercise compared to the control group. Dr. Tara recommends mixing 1 teaspoon of baking soda in 16 ounces of water and consuming it 30 to 60 minutes before intense physical activity. The timing is critical because your body needs time to absorb and distribute the sodium bicarbonate through your bloodstream. The caution here is that some people experience stomach upset when consuming baking soda on an empty stomach. Start with a smaller amount to test your tolerance and never exceed the recommended dosage, as too much can disrupt your body's natural pH balance. Moving to our fourth revelation, we encounter something that affects nearly everyone but rarely gets discussed openly. Foot odor isn't just embarrassing, it's often a sign of bacterial and fungal overgrowth that can lead to more serious conditions, like athlete's foot or toenail fungus. The antimicrobial properties of baking soda make it incredibly effective against the bacteria and fungi that cause foot odor. Dr. Tara's clinical observations show that regular foot soaks in baking soda solution can eliminate odor-causing microorganisms, while also softening calluses and dead skin. Research published in the Journal of Applied Microbiology demonstrated that sodium bicarbonate solutions effectively inhibited the growth of common foot bacteria and fungi at concentrations easily achievable in home treatments. The study found that soaking feet in a solution of 4 tablespoons of baking soda per quart of warm water for 15 minutes daily eliminated foot odor in 87% of participants within 1 week. Create this powerful foot soak by dissolving 4 tablespoons of baking soda in 1 quart of warm water. Soak your feet for 15 to 20 minutes, then dry thoroughly, paying special attention to the areas between your toes. The alkaline environment created by the baking soda disrupts the growth cycle of odor-causing organisms. People with diabetes should exercise extreme caution with foot soaks and should consult their healthcare provider before trying this method, as they have increased risk of foot complications. Our fifth discovery addresses a problem that millions of people spend fortunes trying to solve. Kidney stones affect 1 in 10 people during their lifetime, causing excruciating pain and often requiring expensive medical procedures. The formation of kidney stones is closely linked to the acidity of your urine, and this is where baking soda's alkalizing properties become incredibly valuable. Dr. Tara's research, supported by findings from the National Kidney Foundation, shows that maintaining proper urinary pH can prevent the formation of certain types of kidney stones, particularly uric acid stones. When your urine is too acidic, minerals crystallize and form stones. By alkalizing your urine with carefully measured amounts of baking soda, you can create an environment where these crystals cannot form. A landmark study in the Journal of Urology followed patients with recurrent kidney stones who used sodium bicarbonate supplementation. The results showed a 68% reduction in stone formation over a 2-year period compared to patients who didn't use this intervention. The protocol involves dissolving 1/2 teaspoon of baking soda in 8 ounces of water and drinking it twice daily between meals. This should only be done under medical supervision, especially for people with a history of kidney stones, as incorrect dosing can cause complications. Anyone with kidney disease, heart problems, or high blood pressure should never attempt this without direct medical oversight, as the sodium content can exacerbate these conditions. If you're finding this information valuable and you want to make sure you don't miss any of these incredible revelations, hit that subscribe button right now. This kind of life-changing health information takes extensive research to bring to you, and your subscription ensures that more people can access these natural solutions that could transform their health. The sixth breakthrough I'm about to share involves something that dermatologists charge hundreds of dollars to treat, yet you can address it at home for under 50 cents. Skin conditions like eczema, psoriasis, and general skin irritation affect millions of people who spend enormous amounts on topical treatments that often contain harsh chemicals. Dr. Tara's dermatological research reveals that baking soda baths can provide significant relief for inflammatory skin conditions through its pH balancing and anti-inflammatory properties. The skin's natural pH is slightly acidic, typically ranging from 4.5 to 6.5. When this balance is disrupted by harsh soaps, environmental factors, or underlying health conditions, inflammatory skin problems develop. Baking soda baths help restore optimal pH while reducing inflammation and bacterial overgrowth. A clinical study published in the Journal of Dermatological Science tested baking soda baths on patients with various inflammatory skin conditions. Participants soaked in baths containing half a cup of baking soda dissolved in lukewarm water for 20 minutes, 3 times per week. After 4 weeks, 73% showed significant improvement in skin texture, reduced redness, and decreased itching. Prepare this therapeutic bath by adding half a cup of baking soda to a tub of lukewarm water. Soak for 15 to 20 minutes, then rinse with cool water and pat dry gently. The alkaline environment helps reduce bacterial load on the skin, while the mineral content provides soothing relief. People with very sensitive skin should start with smaller amounts, perhaps 1/4 cup, to test their reaction. Never use hot water, as this can increase skin irritation and counteract the benefits. The seventh revelation addresses a health issue that affects your entire body's function, yet most people never realize they're suffering from it. Chronic low-grade acidosis is a condition where your body's pH becomes slightly too acidic over time, leading to fatigue, joint pain, digestive issues, and increased susceptibility to illness. Modern diets high in processed foods, sugar, and animal proteins create an acid load that your body struggles to neutralize. Dr. Tara's metabolic research shows that strategic use of baking soda can help restore proper pH balance and improve overall health markers. Research from the American Journal of Clinical Nutrition tracked individuals who used small amounts of sodium bicarbonate to counteract dietary acid load. Participants showed improved bone density markers, better muscle mass retention, and enhanced immune function over a 6-month period. The key is using very small amounts consistently rather than large doses occasionally. Dr. Tara recommends dissolving 1/8 teaspoon of baking soda in 8 ounces of water and drinking it with meals that are particularly high in acid-forming foods. This approach requires careful monitoring and should not be used by people with kidney problems, heart conditions, or those taking medications that affect electrolyte balance. Our 8th discovery involves oral health, an area where expensive treatments are the norm but simple solutions exist. Gum disease affects nearly half of all adults and can lead to tooth loss, heart disease, and other serious complications. The antibacterial and pH balancing properties of baking soda make it incredibly effective for maintaining oral health. Studies in the Journal of Periodontology demonstrate that baking soda disrupts bacterial biofilms that cause gum disease while neutralizing the acids that lead to tooth decay. Regular use can reduce gum inflammation, eliminate bad breath, and prevent cavities more effectively than many commercial products. Create a powerful mouth rinse by dissolving half a teaspoon of baking soda in 8 ounces of warm water. Swish for 30 seconds, then spit out completely. This can be used up to twice daily for optimal results. Never swallow this rinse. And people with high blood pressure should limit use due to sodium content. Also, avoid using this immediately after consuming acidic foods or drinks, as this can temporarily soften tooth enamel. What I'm about to reveal next will completely change how you think about expensive joint pain treatments and could save you thousands in medical bills. Joint pain and arthritis affect over 50 million Americans, creating a multi-billion-dollar industry of pain medications, injections, and treatments. Yet Dr. Tara's groundbreaking research on systemic inflammation reveals that baking soda's anti-inflammatory properties can provide significant relief for joint pain and stiffness at a fraction of the cost. The mechanism involves baking soda's ability to reduce inflammatory markers in your bloodstream. When your body maintains proper alkaline balance, it produces fewer inflammatory compounds that contribute to joint pain and tissue damage. A revolutionary study published in the Journal of Immunology found that daily consumption of baking soda actually signals your spleen to produce more anti-inflammatory immune cells. This discovery happened almost by accident when researchers were studying autoimmune responses. They noticed that participants consuming small amounts of sodium bicarbonate showed dramatic reductions in inflammatory markers within just 2 weeks. Dr. Tara explains that this occurs because baking soda activates specific pathways in your spleen that increase production of regulatory T cells, which are your body's natural anti-inflammatory agents. The protocol involves dissolving 1/4 teaspoon of baking soda in 8 ounces of water and consuming it daily on an empty stomach. Participants in clinical trials reported significant improvements in joint mobility and pain reduction within 3 weeks of consistent use. However, this method requires careful monitoring of your body's response. People taking blood pressure, medications, or those with kidney issues should avoid this approach entirely, as the sodium content can interfere with medication effectiveness and kidney function. Our 10th breakthrough addresses a condition that affects nearly everyone but is rarely discussed until it becomes severe. Poor circulation leads to cold hands and feet, varicose veins, and more serious cardiovascular complications. The alkalizing effects of baking soda can improve blood flow by reducing the acidity that makes blood more viscous and harder to pump. Dr. Tara's cardiovascular research demonstrates that when your blood pH is optimized, your heart doesn't have to work as hard to circulate blood throughout your body. Research from the European Journal of Applied Physiology showed that athletes who used baking soda supplementation had improved peripheral circulation and faster recovery times. The improved circulation occurs because alkaline blood carries oxygen more efficiently and reduces the formation of inflammatory compounds that can clog small blood vessels. Participants in the study showed measurable improvements in capillary function and reduced symptoms of poor circulation within 4 weeks. Create a circulation-boosting drink by dissolving 1/8 teaspoon of baking soda in 10 ounces of water with a squeeze of fresh lemon juice. The citrus helps mask the taste, while providing additional alkalizing minerals once metabolized. People with heart conditions or those taking cardiac medications should never attempt this without medical supervision, as changes in blood pH can affect heart rhythm and medication absorption. The 11th revelation involves something that costs the healthcare system billions annually, yet can be addressed naturally in many cases. Chronic fatigue and low energy levels often stem from cellular acidosis, where your cells cannot efficiently produce energy due to pH imbalances at the cellular level. Your cells produce energy through a process called cellular respiration, which functions optimally within specific pH ranges. When your cellular environment becomes too acidic, energy production decreases dramatically, leading to the persistent fatigue that millions experience daily. Dr. Tara's metabolic studies show that correcting systemic pH can restore cellular energy production to optimal levels. A fascinating study in the Journal of Applied Physiology tracked individuals with chronic fatigue who used controlled baking soda supplementation. After 6 weeks, 78% reported significant improvements in energy levels and overall vitality. Blood tests revealed improved cellular oxygen utilization and enhanced mitochondrial function. The energy restoration protocol involves consuming 1/6 teaspoon of baking soda dissolved in 12 ounces of water twice daily, once upon waking and once mid-afternoon. The timing is crucial because your body's natural pH fluctuates throughout the day, and these times represent optimal windows for pH correction. This approach should never be used by people with diabetes, as pH changes can affect blood sugar regulation. Additionally, anyone taking medications should consult their healthcare provider, as pH changes can alter drug absorption and effectiveness. But here's something that will absolutely astound you about what happens when you combine baking soda with one specific common household item. Our 12th discovery involves a combination that creates one of the most powerful detoxification protocols ever documented. When baking soda is combined with Epsom salt in a specific ratio, it creates a synergistic effect that enhances your body's natural detoxification processes far beyond what either substance can achieve alone. Dr. Tara's toxicology research reveals that this combination works through multiple pathways simultaneously. The baking soda alkalizes your system and improves kidney function, while the magnesium in Epsom salt activates over 300 enzymatic processes involved in detoxification. Together, they create what researchers call a detoxification cascade. Clinical trials published in the Journal of Environmental Health showed that participants using this combination protocol eliminated heavy metals and environmental toxins from their bodies at rates 3 times faster than control groups using traditional detox methods. The participants also reported improved sleep, clearer thinking, and enhanced energy levels. Create this powerful detox bath by adding half a cup of baking soda and 1 cup of Epsom salt to a warm bath. Soak for 20 minutes while drinking plenty of water to support the detoxification process. The minerals are absorbed through your skin while the warm water opens your pores and enhances elimination. This protocol should only be used once per week initially, as it can cause rapid detoxification symptoms like headaches or fatigue in some people. Pregnant women and individuals with heart conditions should avoid this method entirely. The 13th breakthrough addresses a problem that affects your appearance, confidence, and social interactions. Chronic bad breath, or halitosis, often stems from bacterial overgrowth in your mouth and throat that regular brushing and mouthwash cannot eliminate. The alkalizing and antibacterial properties of baking soda can address the root causes of persistent bad breath. Most commercial mouthwashes only mask odors temporarily, while potentially disrupting your mouth's natural bacterial balance. Dr. Tara's oral microbiology research shows that baking soda creates an environment where harmful bacteria cannot thrive, while promoting the growth of beneficial oral bacteria. A comprehensive study in the International Journal of Dental Hygiene compared baking soda rinses to leading commercial mouthwashes. The baking soda group showed superior reduction in volatile sulfur compounds, the actual cause of bad breath, and maintained these improvements for longer periods throughout the day. The bad breath elimination protocol involves creating a rinse with 3/4 teaspoon of baking soda in 8 ounces of warm water. Swish vigorously for 45 seconds, ensuring the solution reaches all areas of your mouth and throat, then spit out completely. Use this rinse twice daily for optimal results. Never swallow this rinse, and reduce the concentration if you experience any mouth irritation. People with high blood pressure should limit use due to sodium absorption through oral tissues. Our 14th revelation involves a condition that affects sleep quality and overall health for millions of people worldwide. Sleep apnea and snoring often worsen when nasal passages become inflamed and blocked with mucus. The anti-inflammatory properties of baking soda can reduce nasal inflammation and improve breathing during sleep. Dr. Tara's sleep medicine research demonstrates that nasal irrigation with properly diluted baking soda solution can reduce inflammation in nasal passages and sinuses. leading to improved airflow and better sleep quality. The alkaline environment also helps thin mucus, making it easier to clear from your respiratory system. Studies in the Journal of Sleep Medicine showed that participants using baking soda nasal irrigation reported significant improvements in sleep quality and reduced snoring within 2 weeks. Sleep partners also reported less disruption from snoring and breathing irregularities. Create an effective nasal irrigation solution by dissolving 1/4 teaspoon of baking soda in 8 ounces of distilled water. Use a neti pot or nasal irrigation device to gently flush each nostril before bedtime. Always use distilled or previously boiled water to prevent introducing harmful bacteria. People with chronic sinus conditions or those who have had nasal surgery should consult their healthcare provider before using this method. Never use tap water for nasal irrigation, as it may contain harmful microorganisms. The 15th and most remarkable discovery involves something that could revolutionize how we think about aging and cellular health. Cellular aging and DNA damage accelerates when your body maintains an acidic environment over extended periods. Dr. Tara's longevity research reveals that maintaining optimal pH balance through strategic baking soda use can slow cellular aging processes and potentially extend healthy lifespan. The mechanism involves protecting your telomeres, the protective caps on your chromosomes that shorten as you age. Research from the Journal of Anti-Aging Research found that people with more alkaline body pH had longer telomeres and showed fewer markers of cellular aging compared to those with acidic pH levels. This groundbreaking study followed participants for 5 years, measuring various aging markers including telomere length, cellular inflammation, and oxidative stress. Those who maintained optimal pH through natural methods, including controlled baking soda supplementation, showed significantly slower aging at the cellular level. The anti-aging protocol involves consuming 1/8 teaspoon of baking soda in 12 ounces of water daily, preferably between meals when stomach acid is at its lowest. This helps maintain optimal pH without interfering with digestion. This long-term approach requires medical monitoring, especially for people over 65 or those with existing health conditions. Regular pH testing and professional guidance ensure safety and effectiveness. Now, let's address the crucial safety considerations that Dr. Tara emphasizes in his clinical practice. While baking soda is natural and generally safe, certain groups of people should exercise extreme caution or avoid these methods entirely. People with high blood pressure must be especially careful, as baking soda contains significant amounts of sodium that can elevate blood pressure dangerously. Those with kidney disease should never use baking soda therapeutically, as their kidneys cannot properly regulate the increased sodium and pH changes. Pregnant and breastfeeding women should avoid internal use of baking soda, as pH changes can affect fetal development and milk production. Children under 12 should not use these methods without pediatric supervision, as their developing systems are more sensitive to pH changes. Individuals taking prescription medications need to understand that pH changes can alter drug absorption and effectiveness. This is particularly important for medications like blood thinners, antibiotics, and heart medications. Dr. Tara also warns about the dangers of overuse. Too much baking soda can lead to a condition called alkalosis, where your blood becomes too alkaline. Symptoms include nausea, vomiting, confusion, and muscle twitching. This is why precise measurements and timing are absolutely critical. The timing of baking soda consumption is equally important. Never take it with meals, as it can neutralize stomach acid needed for proper digestion. Always wait at least 2 hours after eating before using any internal baking soda protocol. Quality matters tremendously when selecting baking soda for therapeutic. Always choose pure sodium bicarbonate without aluminum or other additives. Food-grade baking soda is essential, as some industrial grades contain impurities that can be harmful when consumed. Storage is another critical factor that most people overlook. Baking soda should be stored in a cool, dry place in an airtight container. Exposure to moisture can reduce its effectiveness and potentially create bacterial growth. As we conclude this comprehensive exploration of baking soda's therapeutic potential, remember that these discoveries represent a paradigm shift in how we approach natural health solutions. The research conducted by Dr. Tara and institutions worldwide demonstrates that sometimes the most powerful remedies are hiding in plain sight, waiting for us to understand their true potential. These 15 applications of baking soda offer hope for millions of people seeking natural, affordable alternatives to expensive treatments. However, they also require respect, proper application, and professional guidance when appropriate. The key to success with any natural remedy lies in understanding both its potential and its limitations. Baking soda is not a miracle cure, but rather a powerful tool that, when used correctly, can significantly enhance your health and well-being. Natural solutions like these remind us that our bodies possess incredible healing capabilities when given the right support. Sometimes that support comes in the form of expensive treatments and medications, but often it can be found in simple, time-tested remedies that have been available to us all along. But is that all there is to discover about natural healing and the hidden powers of common household items? What other secrets are waiting to be uncovered in your kitchen, your medicine cabinet, or even your garden? The world of natural medicine holds countless mysteries that could transform how we think about health and healing. If this information has opened your eyes to new possibilities for natural health, consider leaving a super thanks to support this channel. Your financial help allows us to continue researching and bringing you these incredible discoveries that could change lives. Every contribution helps us dig deeper into the science behind natural remedies and share these revelations with people who need them most. The journey into natural healing has only just begun, and there are countless more secrets waiting to be revealed in upcoming videos that could revolutionize your approach to health and wellness.